Thank you, Madam Deputy Speaker. I'm pleased to be called on this debate, and it's an important one that we have it. When we talk about the NHS, we can either argue about specific investments or general principles. And like many colleagues, I have received a great amount of correspondence highlighting no end of specific areas where investment is needed. Looking towards my constituency, I could also speak about the need to invest in urgent treatment centres in Todmorden, celebrate the work of Colesdale and Huddersfield NHS Trust, just two things that I continue to raise with my honourable friend, the Secretary of State for Health. However, as I have the privilege, among others in this chamber, of sitting on the Health and Social Care Select Committee, I do want to talk in more broad terms of some of the problems facing our health and social care system and about how the proposed shifts in the NHS need a reprioritisation of resources. I'll be focusing on what I argue is the most important of these shifts, the so-called left shift of care from hospitals to the community, something that the member for the North Cotswolds has already outlined the need for very well, although to hear him speak you'd think that it had come from on high and not been the result of 15 years of previous government. With 1 in 10 people stuck on waiting lists in the healthcare system, it's becoming increasingly hospital-centric. Those lists will only grow if we continue on the same course. And there's no solution to our crisis in emergency medicine without a left shift of solving problems earlier and closer to home. Of course, we need hospitals and we need to invest in them, but they should be where people go with acute and complex cases, not where they go for want of working services elsewhere. But despite the need to shift to care to the community being obvious to just about everyone, one of the most glaring revelations in the Darcy report was just how poorly successive governments have gone about achieving that. Meanwhile, we're not training or retaining enough GPs, and this is where the renegotiations of the contracts are important. In Calder Valley, the retention crisis has meant that Bankfield and Church Lane surgeries, the North Home practice and Rastrick Health Centre all have a ratio of patients to fully qualified GPs that is far higher than the local, regional and national averages which simply don't meet the need for what we need from our health service. And over a decade after the Dilnot report, social care remains a forgotten service, or the Cinderella service, as my honourable friend for Poole artfully called it. With 1.4 million social care staff, our care system is in fact the same size as the NHS workforce, but it receives nothing like the support or understanding of other areas of our healthcare system. The consequence of this is that week after week our committee heard about delayed discharge. 20% of beds in my own local hospital are taken up by people who should be treated at home or closer to home. Meanwhile, carers are missing their appointments because they're delivering care to loved ones and they end up with worse illnesses, adding to the strain on the NHS. Madam Deputy Speaker, in less than a year, this government has ended the industrial action in our NHS, delivered 2 million extra appointments, and is now setting up a new deal with GPs. But that can't be the extent of our actions. Just as the 10-year plan can't continue down the same road as the last government took us, we're trying to fix the crisis in the NHS by putting more money into hospitals. That tackles the symptoms but not the causes. So when setting out the estimates, I urge the Minister to be mindful of the shifts that we need to ensure our funding not only increases, but increases in focus on community and social care. That's what we need for a sustainable system that will protect the rest of our health service in future, because a sustainable system is the only way to deliver better health care and better social care for people across this country. Yeah.